Hello, my name is Renee Korczak. I'm a sports dietitian for nutrition counseling services at RWJBarnabas Health Ambulatory Care Center. I also work really closely and partner with collegiate and high school teams in tandem with Matthew J. Morahan too, Health Assessment Center for Athletes, and I'm very excited to talk about safe supplement use. So first and foremost, we just want to understand what are dietary supplements. Dietary supplements are simply intended to add to or supplement the diet. They are not a replacement for food. They should not replace food in your diet, and they are very different from food itself or for drugs. Supplements may include certain ingredients. These might include vitamins, minerals, herbs or botanicals, ginger, echinacea, to give you an example, amino acids, or live microbials such as probiotics. The FDA, or the Food and Drug Administration, does have a definition of dietary supplements on their page. I've included that link below. But I think the main point is that yes, dietary supplements are really intended to supplement diets, as most Americans do have some dietary gaps that they're trying to fill. What are the benefits and risks of dietary supplements? Well, really, there's a number of benefits, and there could be some risks as well. So, for benefits, it really can help with the maintenance of health or could help improve health. They help fill dietary gaps for shortfall nutrients. We know by looking at data from dietary patterns in the United States that there are dietary gaps to fill, and not everyone always eats, perfectly all the time. So athletes may have dietary gaps for things like vitamin D or vitamin C. Fiber is a shortfall nutrient. So there are certain ways that we can add those nutrients to our diet through the use of supplements. We just don't want them to be taking the place of food. There are some risks. So if you are taking medications, you certainly want to check with a healthcare practitioner prior to starting a supplement, because some supplement ingredients may interact with medication. So definitely check with a healthcare provider. And then if you are an athlete practicing in a collegiate sport, you definitely want to work with your sports dietitian really closely, and also talk to your athletic trainer or coach, because some supplements are definitely banned from use in certain guidance, like the NCAA. Okay, when you are taking some supplements and if you're working closely with a sports dietitian, one of the things I like to point out to athletes is that if you're going to use a supplement, it's really important to look for brands that have been inspected for quality. So in the sports world, there are some symbols you could look for. These seals, such as NSF Certified for Sport, Informed Sport, or USP symbols, you should see these on packages and supplement labels, and that really is a trigger for you to know that the product has been tested for quality and it's safe and efficacious. How do you evaluate supplements in a collegiate setting? Again, if I'm working with a team that falls into, the NCAA guidance, they definitely have guidelines that you have to follow and read really closely and make sure that things that you're using in practice are permissible. If they're impermissible, those things could show up in blood work or other tests that are done on athletes throughout the season. So there's a good website there that really gives you all the information that you need. But generally speaking, there are things that are helpful to athletes that certainly are permissible, things like basic vitamins and minerals, your vitamin D, your vitamin C, energy bars, omega-3 fatty acids, any carbohydrate and electrolyte containing drinks to help with hydration and prevent dehydration are certainly permissible. So there is a long list of items that are allowed. If you are wondering if a supplement is for you and if you should be including those in your diet, it's really important to work with a sports dietitian and reach out to us. And you can do that two ways. You can call Nutrition Counseling Services at 973-322-7913, or you can simply visit our website and go ahead and look for the information there as to how to schedule an appointment. I'm going to leave you with some resources. So again, NCAA has some great resources on drug testing and talks about safe supplement use. And the American Sports Performance Dietitians Association, which I'm a member of, also has some great resources on safe supplement use in athletes. Thank you so much.